Hi, everyone. Welcome to the podcast. Where can you get the best medical information anytime and anywhere? Right here on The Smartest Doctor in the Room. I'm your host, Dr. Dean Mitchell. Please note this podcast is for informational purposes only and not personal medical advice. Please consult with your trusted healthcare professional for concerns about your health. So, we have all experienced the cuts and bruises in our lives, and many of us have actually gone, quote, under the knife, for a surgical procedure. Afterwards, we are left with a scar that over time will fade, but just sometimes doesn't feel like our original skin. In medical school, one of my first pathology lectures was all about inflammation and healing, and actually how scar tissue forms with the connective tissue coming in. But I have to tell you, for the rest of my medical training, I never heard another word about scar tissue or how it affects us. My guest today, Marjorie Brook, is an internationally known educator and medical massage therapist who has spent over 30 years in her career caring for and teaching healthcare practitioners about her expertise. As I've mentioned before to patients, I'm pretty open-minded. And obviously, though I have a medical degree and I'm a conventional doctor and I do a lot of holistic medicine, I'm always searching to find people doing unusual things that I think could benefit my patients, that I want to learn more about. And I was really fortunate because I had a really smart patient that was a mutual patient of Marjorie's and myself. And when I heard what Marjorie was doing, I was like, I'm very curious. And we got to meet up, and I've actually come to her as a patient. I think she does great work. And I just really wanted her on the podcast to talk about her work with scar tissue and some of the other things she does. So it's my pleasure to welcome Marjorie Brook to the podcast.
Hi, Dean.
Okay, so the first thing we will get into is scar tissue, because that's what actually got me interested in meeting you. This was all right before COVID broke. I don't know if you remember. We got to finally meet at a conference you came to. I was speaking and you came to attend, which was really nice. But as I mentioned in the introduction, scars tend to remind us of an injury or an operation. And sometimes also even psychologically kind of tells us that we're no longer perfect. But maybe you could give sort of a broad overview of what you see, how you look at scar tissue, and if you could even explain to some degree what a scar is.
Well, basically, when people think of scars, they think mainly of the aesthetic look of how it altered the way they look. But what people really don't understand is that scar tissue can affect every single system in the body. I'm not saying that every single scar is an issue, but every single scar has the potential to be an issue, right? And people don't even realize that the scar tissue is actually causing a problem because the doctors don't talk about it. All the pains that people have or things that people say, oh, it'll fade in time, or it's just going to be that way, can actually usually be traced back to the scar tissue. Scar tissue is actually the tissue that replaces the tissue that's been injured. All right. And a lot of people, you hear things about breaking up scar tissue and taking scar tissue away. Well, you really can't do that. Scar tissue literally has to be there. Every wound heals with some form of scarring, and it's meant to be there. And the point is, you just have to understand that it's not as effectively able to behave and perform as well as normal tissue. It's only about 80% as functional as normal tissue at its best. But scar tissue left on its own can have multiple issues and multiple problems. It can run rampant. It can spread through the body. It can cause restrictions. It can cause pulls. It can interfere with the circulatory system. It can interfere with the electromagnetic system in our body. It interferes with the energy. If you're going to go with traditional Chinese medicine, it actually can block and interfere with everything in our body, with every single system.
Okay, I'm going to stop you because that's a lot to swallow.
Sorry. First I have it.
No, I know. No, it's good. You always provide a lot of information. But I want to try to take a little bit simpler and then we're going to go deeper. So again, the way I visualize it, and what's interesting is because scar tissue could be on the skin, as you know, on the tendons, on muscles, internal organs, I guess.
Yes.
And I tend to think of, again, from my medical training, as scar tissue being, see, this is where the problem is, almost like glue, or that's like a layman's term, but the collagen coming in, which is not the original tissue, right? So just for example, I mean, if you get a scar on your face, I mean, you have what we call dermal cell, epidermal and dermal
Mhm.
cells, and then where that cut is, whether it's done by a doctor or if you got an injury, that tissue comes in and heals, and it's collagen tissue, which is not the exact same tissue. Am I saying this correctly? As the original skin tissue. So it's like almost like a filler
Well, no,
or
it's
part of
it's
it.
actually it's a pretty much forms this is formed out of the same materials, only it gets excessive collagen, too much collagen, because you
Mm.
have collagen in your regular tissues. What it is the way the tissue reknits itself together. If you think of the
Hmm.
collagen fibers as threads that are all getting basket weaved in to fill in the scar, where formerly the tissue went like this,
Right.
now the tissue's like this, and this is the problem.
So it's almost like, right. It's almost like essentially like a sewing up of the tissue.
Yep.
So it gets stronger, because this is not typically, scar tissue is not as strong as the original tissue. Is that correct?
Correct. So
Hmm.
at its best, left to if it's healed as best as it can, scar tissue is about 70 to 80% as functional as normal tissue, which means it's not stronger, it's actually weaker. And it can interfere with the tension. Like your skin is meant to has tension to pull in a certain way, but if
Hmm.
you have a cross, now it can't do that. Now it's pulling
Now
in
there's some
different directions.
limitations.
Yeah, it's not moving the way it was designed. It's limited, and those pulls can end up pulling throughout the whole body. It's like a one big
Right.
chain. And you
Right.
can have a scar on your shoulder and it could be pulling and end up causing a problem down by your ankle on the other side of the body.
Wow. Wow. Does it matter also how old a scar is, especially like when you see patients? I mean, obviously, maybe until somebody finds out about you, their scar is 10 years old, or maybe someone's fortunate and they've seen you in the last 6 months when they noticed the scar either wasn't healing right or was giving them problems. So does that matter to you when you're caring for them?
It doesn't matter how old a scar is. I've worked on scars as old as 80 years old and made a difference. Our tissue
Mm.
is very elastic, and we can alter and change our tissue. That's not an issue. The connective tissue, the fascia. And
Hmm.
as soon as the best thing is you want to start working with the body as soon as you have the injury. Not necessarily working. You want to allow the first 3 months to allow the body to actually scar. It's supposed to scar. That's
Right.
how it heals.
Right. Right.
Unfortunately, people go after the scar way to the injury too soon to avoid a scar.
Mm.
Like they actually make a worse scar because they don't allow the body time to heal.
Well, a lot of times you'll hear, I mean, I listen to, like, with athletes, that they go through all of this immediate um, treatments to, quote, minimize the scar. Is there such a thing as that, really? Or,
Well, yes, if you work with your body the way it's designed,
hmm.
very light lymphatic work, myofascial work, very gentle, slight range of motion movement,
Hmm.
and proper bandaging from the very beginning, and you work your way into it with respect to the wound healing, then yes, that's you can minimize and you can avoid scar tissue forming. Unfortunately, a lot of the therapies out there attack the scar way too soon or the wound while it's healing, and therefore create more scar
So
tissue. They do
what
the
is
opposite
the
of what they're doing.
so what is the minimum amount of time before somebody should even consider scar tissue work?
Well, there's two different stages. When it's first healing, within the first 3 months, you can right away, like in the hospital bed, if you want, start doing lymphatic and myofascial, which are very, 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 very light, very, very, very gentle work that guides the collagen and the tissue to
Mm.
heal in a better pattern, in a proper, more congruent to the current tissue around it.
Okay.
Gentle range of motion after a couple of weeks. So you can start right away, but gentle, gentle, light. Then
Hmm.
about after 3 months, when the tissue is more set and technically the wound's considered mature, then you can start getting a little more aggressive. And by aggressive, I mean just going a little more in the idea of releasing the tissue and getting the tissue unstuck versus breaking it down and ripping it apart. That's the last thing you want to do.
Right. Right. Yeah, that makes sense. Um, is there anything with, I'll call them cosmetic scars, but again, it's on somebody's face that they get, very understandably sensitive about this. Is there any kind of creams or lotions or anything in the, that somebody, let's say they've had a surgery that's affected, their face that they can put on that does help healing? Because they used to say, what was it? There was a cream that was sort of based on onions. I forgot the name of it.
Oh, I don't know that one.
You don't
There,
know
there
that
are a
one? That was,
lot.
I remember, because I remember my son Stone, who you've met. He was about 7 years old, 6, 7 years old. He fell in a playground and he really got a real bad gash on his chin. And we took him to this really good plastic surgeon who sewed it up, and then he gave us this cream that was I look, oh God, I'm blanking on the name of it, but it was based on really like onion.
Mhm.
Uh,
There are a lot of creams out there, and there are a lot of there's essential oils. There are things. There's a lot of essential oils that you can put on that will help heal. My only thing is like with a lot of the creams that are on the market that they all talk about are based in silicone, and I'm not a fan of
I
silicone,
understand,
even though
right?
a lot of plastic surgeons and everybody recommends it. There's oils like bio oil and essential oils. Your basic, your go-to since the beginning of time is lavender. There's rose hip. There's all kinds of oil and all kinds of oil
Why
concoction.
do the oils help? How do they, because I can understand sometimes, it's interesting, like in nature, a lot of people, especially from Europe, believe a lot of the vegetables or fruits or whatever have some very, healing ingredients. What's in these type of
Each
oils?
oil is different. The
Okay.
rose hip or lavender, like in and of itself, lavender oil is from lavender, rose hips is from rose
Right.
hips, and basically many of them have very good healing properties. And there's recipes that will combine them and help facilitate the healing in the body, to support it and facilitate it.
Okay. What about if we're talking about an internal scar? So meaning, let's say if somebody's had colon surgery, and I again remember I used to see these cases in the hospital when you would hear a story, oh, a person had, colon or some type of gastric surgery, even who knows, a few years before, and now they're coming in, they're vomiting because they have what's called adhesions, meaning the tissue just all kind of just got clumped together. Um, what can be
Well,
done for that?
Oh, there can be a lot. First, what most people have to understand that every single surgery ends up with adhesions. If you're doing abdominal or pelvic surgery, like you mentioned with the colon, you're looking at almost 100% guarantee to have adhesions,
Mhm.
and nothing is ever done to prevent that. Basically, right away, there's a form of therapy called visceral manipulation. Again, with the myofascial, with my scar work. Once we can get in there and working manually, we can help release and realign the tissues. And the one thing you do want to break down adhesions. Adhesions can be broken down as averse to scar tissue. And it can be done. Unfortunately, nothing gets done until all of a sudden now we're throwing up, we can't eat, we're in pain. So then they go, okay, let's cut you open again and clear out
Right.
all of the adhesions, which only leads to more adhesions and more scar tissue. It's a very bad
How do
cycle.
you do that? Do you actually you can feel where in the abdomen the adhesion is from your from your touch
So yeah,
sensation?
sometimes you can basically feel again because we're basically all one piece. We're all
Right.
connected. Everything's connected to everything
Right.
else. If
Right.
you think of a spider web and you pull on one end, the whole web moves and alters.
Yeah.
That's basically the way we are. So as I manipulate and move the skin, I can feel a pull. I can feel a tension. My clients will verbalize if that's where it is. That's the pain. That's like when I stand up, I feel it. Every
Yeah.
time I go to reach for a can of peas, that's where I feel the pull,
Mm.
just like that. So
Mm.
you can recreate it, find the area, and work systematically. You mentioned onion, which is ironic, but like an onion, layer by layer by layer down to
Mm-hmm.
help release and reset and restore the tissue and the body back to function. But what a lot of people also have to understand, especially if there's major scars and major things, it's not just about releasing the scar tissue, it's about resetting the whole body system because you've been compensating and moving different ways than you were designed to move, whether be it from the injury, the disease, the disorder, and then recovery from the surgery. So the body's now in a different mode of function, and we have to re-put it back on the correct path, functioning the way as best we can is the way it was designed to function.
What I found fascinating when I came to you too, because I had a scar on my face, from a skin cancer, and I asked you to work on it because I know about your, how great you are with those things, and then you took out this little, this little machine, and it was like sort of like an electric buzzer. I can't explain it better than that. And I was asking you, like, what does that do? And you were explaining, maybe you could explain to the listeners that how even scars have different polarities.
Mm-hmm.
So we're talking about, essentially, negative and positive forces. So how does that work?
Well, the electromagnetic system that runs through all of our bodies is
Hmm.
negatively charged. Scar tissue, when it forms positively charged due to when the blood comes in to help form the clot and form it. All the function, the elements are positively charged. So the iron, everything. If you look at the symbol chart, you'll see the iron is positive. So that area heals in a positive charge. Now that's an issue because all of your healing agents, your magnesium, your potassium, and the rest are also positively charged. So when you have a positive end of a magnet meeting another positive end of a magnet,
There we
they
go.
repel. So not
Yeah.
all of the healing agents that need to get in to heal properly will get there. So through polarity therapy, which is a therapy designed function solely focused on the electromagnetic currents that run through your body, you want to flip the polarity in the scar back to negative. That does not turn the scar tissue into normal tissue, but it makes it now congruent with the tissue around it, and it's not going to block healing agents, circulation, or anything else that wants to go through.
Is this like Eastern medicine? Because again, I've never heard, till I met you. No, I find this fascinating. Again, unfortunately, I did a podcast, one of
Mhm.
my original ones with Kevin Tracy, who's really an amazing neurosurgeon and is considered the father of electric medicine. But it's such an area of Western medicine that's not really even talked about. So I was just curious because again, you have so many. How do I put it? You have so many different skill sets that I was just curious where you picked that up. I mean, do they
Well,
teach that? Do
polarity.
they teach that in medical massage
No, they
hospital?
don't. It
Or-
was
I
just
didn't
a
think
therapy
so.
that
You picked up, from
as
one
I
of
was
your.
coming along and I came into,
Hmm.
you mentioned traditional Chinese medicine. The energy meridians and the energy channels that you're dealing with TCM is different than polarity. We have
Oh.
multiple systems that people don't realize are running through our body. There
Mm.
is the energy system that is the traditional Chinese medicine, your liver channel, your stomach channel. You've heard all of those. And then polarity is your electromagnetic current that runs through your body. It's a totally different system, electrically charged system that runs through your body. That's the negative and the positive versus the energy of the organs and the body that's running through with traditional Chinese medicine. Those are the channels that your
Okay.
acupuncturist is looking to, or acupressure
Right.
therapists are using to tap into.
Yeah. No, I think it's really fascinating, that, and again, unfortunately, conventional medicine doesn't, they're busy with pharmaceuticals and surgical
Mm-hmm.
procedures, and something that could be as healing, non-invasive is the kind of work that you do and other people in acupuncture really has a place in the whole armamentarium of caring for patients who are suffering out there. I want to ask you
What
about, yeah,
No, I was just going to say, unfortunately, usually most of the time, the medicines that are given are actually working in opposite. They're treating symptoms and
right.
they're actually masking or interfering with the actual issue. They're making the issue worse as opposed to healing. They're just masking the symptoms. Whereas when you're dealing with someone who's doing body work or acupuncture or a type of healing in a different, what they call alternative form of therapy, I love that they call it alternative when it was here first. Um, um, we're actually looking at the whole body, every system, and working with, not against. And unfortunately, most of the meds do not do what they
Yeah,
often say.
I
I
think
can't
it's really
tell.
important point for me to just jump in here
Yeah.
and confirm what you're saying, because again, it
Mhm.
was really eye-opening to me when I had over 10 years ago my ankle surgery. And the one thing the orthopedic surgeon warned me, he says, do not take non-steroidal anti-inflammatory medication if you're feeling any pain. He goes, it inhibits the healing of the tissue. And even not even just from a surgery, I was hearing from other orthopedics that again they were even familiar with if you get an ankle or knee tear or any of those type of injuries. Unfortunately, of course, the Advil, which is a non-steroidal anti-inflammatory, ibuprofen, will take away the pain, but so will Tylenol. But the ibuprofen, in fact, inhibits the healing
Mhm.
process. So I just think for listeners who may not like to hear that, I think it's important,
Well, really, people are in agreement with you. And just an example is that on the other side, besides the regular over the counter, people turn to organic herbs and things like that, and they think they can just take anything. Like you can't. You have to really research. Like if, for example, if you have MS, the last thing in the world you can take is echinacea. And everybody's like,
Mm,
oh, echinacea is just an herb. It's great. It makes you
mm,
feel bad. But for MS, it brings the MS full blown. It's
mm-hmm,
like the worst thing you could do. You
that's a great
really
point.
should never take anything, whether it's organic, considered natural, or whether it's prescribed by your doctor. I'll even go that way without researching it first and looking how it interacts with everything else that you take. Because a lot of people will take the doctor's prescriptions, not realizing that they're already on taking natural herbs because they're told to take it,
Right.
and they can't go together. But you never told the doctor that you're taking them because, oh, it's just herbs. You
Exactly.
get you can't.
You just did the promo for my podcast next week. I'm going to
Oh,
be doing a
good.
solo. I'm doing a solo one on the most dangerous medicines in your medicine cabinet, and really all of it is over the counter and
Yep.
possibly some supplements because you have to
Mhm.
know. I mean, I tell patients this all the time because I have patients that come in a lot of times with like 50 supplements, and I go
Mhm.
one by one, I start taking them away, and
Right.
I say, look,
Mhm.
I do believe in supplements. I think they have to be very targeted. I also, from my experience, I like to hear from several sources that these really have a good record of
Mhm.
safety and proven effectiveness. Otherwise, why take it? I mean, just because you saw a commercial or a friend told you about, et cetera, and realizing, yeah, bad things can happen. Just because it's not, quote, a prescription medicine doesn't make it safe or have no adverse side effects. So you really brought up a key point.
Well, another point you can add to that is in the United States, for those that are listening in the US, the FDA does not control, regulate herbs
Yeah,
and natural supplements. It is controlled in Europe
that's right.
and other countries. It is not monitored and controlled here in the US. That's why, like my one patient who I discovered was taking echinacea MS, he bought it here in America, and there's no warning on
No,
that label. If you
no.
bought echinacea in Europe, it would have had a warning label that said, if you have MS, do not take.
Yeah,
So
it's
you
more
can't really,
regulated.
you have to, no matter what. And I see this because of all of my patients. I see many people with cancer, with coming back from severe diseases, from surgeries, all of that, is that you have to be your own advocate and you have to research. Don't just blindly put stuff in your mouth and take or do what the doctor says. Trust your doctor, have doctors you trust, but also research and be solid and secure in your own understanding of what's happening. Many times people just blindly do what's being told, and it's really the wrong thing to do for you, maybe just for you. Maybe, the way your body works, the way you believe, the way you heal may not be congruent with the doctor that you're currently using.
Yeah, that's a
So,
great point. I think that, and what you're saying, and I really, again, I want the listeners to really take this home. It might be one of the most important things we're saying, aside from all the scar tissue work, is that an expert. Um, find an expert in things that you're taking. And I don't mean just online. Try to find, if you can, it could be a naturopath, it could be a functional medicine doctor, it could be a really experienced holistic practitioner like yourself. Because again, you can go into a health food store, some other place, and be told a lot of things. You can see ads online. And again, yeah, you're not getting those warnings. Europe is way ahead of us in controlling and
regulate.
overseeing these things.
Mhm.
The United States, there was a lot of upheaval. I remember this about 20, 25 years ago when they were essentially trying to really regulate the the how do I put it, the supplement business. And boy, they have a strong lobby. I wish the AMA was as strong as them. They went to Congress and they beat back all the laws and everything. And it was good and bad. I mean, of course, people should have access to things, but again, doing something blindly is not a good idea.
Or because the commercial that showed up during your game on
Right.
your phone told you to take it.
Yeah. Yeah. Quote,
Yeah, that's
quote,
the new, that's
flex,
the new one.
flex, ice something, icy hot patches. I don't know. All these things, who knows if they work.
That, and not just the supplements, but also like there's a new thing being advertised for sciatica where it's a compression neon where you keep a pressure point activated with it wrapped around, puts like a pressure against the pressure point on your leg. And I had a client who bought it and he came in almost crippled because his leg had spasmed out because he wore it for 24 hours. And
Mm,
you can't keep pressure on a pressure point or an acupressure point
right.
for 24 hours. And because he didn't listen. Also, people, when you taking advice, when you're listening to what your doctor tells you in regard to how to do things, what you should and should not do, you also have to understand that there may be time limits on that. You need to be more thorough when you ask your questions, because I have people who have not done things. Like I have a woman who didn't move her arm. She had breast cancer and the doctor told her to limit the range, the motion of her arm. And when she came into me, she had lymphedema, her arm was swollen, and she wouldn't let me touch her arm. And I said, well, how long ago did you have the surgery? And she said 20 years.
Oh my
So
God.
she was limiting the range of motion of her arm for
Oh
20 years
gosh.
because the doctor told her,
Right.
don't use the arm, but he didn't give her like within a reasonable amount of time. So
Yeah.
you have to really break down everything that's told to you when it comes to taking medication, when it comes to advice for movement, for therapy. I cannot tell you that getting back to scar work is, I have patients who the doctors tell them there is no such thing as scar work and that scar work can't help. And
No.
then they go on suffering, and then they come to me.
Yeah. No, I
And
know.
then they go, well, why did, or I have parents bringing kids in after surgery, and the kids have, and I start working on the scar and fixing the range of motion and getting the kids' gait back. And they're like, well, why didn't they tell us about this from the beginning? I would have worked on the scar every day with him. Because they don't believe in it. And that's the thing that's just insane, is that they don't believe in the effects of scar tissue when it's the scarring that they're creating
Yeah.
themselves.
Well, this is also, unfortunately, I think it's changed a lot, but there was a long time also doctors didn't believe in cardiac rehabilitation, pulmonary
Right.
rehabilitation. I don't even know if they believed in physical therapy. So yeah, I mean,
Well,
you have to, as you know, I know, you have to be your own advocate. Again, part of what this whole podcast is about is getting that information that empowers you. Because you see, I always looked at, I like reading, aside from all my medical journals and heavy duty books, I'll tell the truth, I like People magazine, because sometimes you read about the celebrities and sort of, aside from all their dating issues and everything, they talk about sometimes when they've had medical problems. And a lot of these people have access to some of the best and cutting edge people doing, good medical work. I want to transition before we go into something else really interesting that I didn't even know you did till I got to meet you. But before we finish on this area of scars, I want to just talk about sport injuries, because so many people try to be athletic, and people, you get on I always say the only people who don't get hurt are the people who are laying on the couch. But you go out there and well, even on the couch, I guess you could get hurt. But but people that go out there and get ligament or knee injuries, and myself, I've had ankle issues. The old acronym was RICE: rest, immobility, compression. I forgot what E is. Elevation. Okay. And then they started hearing about MICE, and not the kind that run around, where movement, et cetera. And then you see sometimes a lot of the pro football players, again, they're getting banged up. They jump into those freezing cold ice baths, which I never want to do. You see other people go into whirlpool jacuzzis. Again, a lot of these other guys get massages several times a week. What would you recommend for the weekend warriors, the average person? And again, I'm sorry, one other thing too, the timing of this was like, it's interesting. I read an article a couple of years ago. There was, people that were training for the marathon. And the marathon is 26 miles. I'm not really sure why anybody likes to do that, but I was reading a story about these people, who had regular jobs, but like 4 times a week they were going to physical therapy. I mean, it was like a major, another job to stay, mobile, putting all those miles in. So with that whole thing, what do you recommend? Again, if I came to you or somebody said, Marjorie, what's the best way, to recoup after workouts, treatments, if you can give us some sort of generalized guidance.
Okay. Well, first off, everybody is individually different.
Okay.
But that being said, a proper maintenance program, like people see that exercise, weightlifting, running, that's all they need to do. And it's not. That's when you're working your muscles and you're increasing your strength, and that you're actually doing damage to the muscles as well. So in order to bolster and increase your ability to get faster, to gain muscle, to be more flexible, is you need a proper maintenance program. And by maintenance, I actually mean the proper way of stretching. Most people don't understand how to stretch, but a very good targeted stretching program. If you're going to be a weekend warrior, you're going to work out a couple of times a week, I really recommend at least minimum once a month getting a very good massage or acupuncture. But I do recommend the massage. You need to maintain the body. There's 2 levels to it. It's not just the strength training. It's not just the actual exercise. You need the stretching for the flexibility. You need the massage to help the body recoup. You need a proper diet that fits with what you're doing. And you need to do everything in a balanced manner. Like you mentioned, you said who would want to run 26 miles? Well, when you talk about runners, they're addicted to their running.
Yeah, I
I
know.
have my CrossFitters that are addicted to CrossFitting, and they'll go and go. They don't care that they're injured. They still. I had someone who ran a marathon with a boot on her ankle.
Oh my God.
Yeah, because she wouldn't want to miss. Yeah. So once you're up
Okay,
there,
so it is. It's a little bit of a cult, but it's a good.
it,
At least
well,
it's a healthy
everybody
cult.
has, and I have people who are addicted to like Beachbody, which are the home
You know
videos
what
that
I'm
they work.
addicted to.
Yeah, yep. I have people like the home videos and they're working out. And part of the problem with two separate things, the weekend warrior, the running, or I'm going to add it all together. Many people are working out or doing their sport improperly. Like they haven't
Yeah,
had the proper training, or they're in the gym and they're listening to the gym rat that's at the boot at the dumbbells next to them. You have people who are learning via video for their exercise classes, and they're doing bouncing, jumping, cardio without proper form, even in the live group classes, and the instructor never leaves the front of the room. Then they're not individually looking at you and how you perceive what they're saying. There's four gates. There's what the instructor wants to say, how the instructor says it out their mouth for the instruction, how you perceive it going in, and then how your body reacts to what you perceived. So there's four gates that the movement is going through. So by the time it gets through, you'll probably think you're doing the right thing, and you're totally not.
yeah.
But you don't know that you're not. So you have to, again, with any sport, any exercise, balance, understanding of how to do your sport or exercise properly, and then do the maintenance. That's really the best thing that you can say. And also let yourself heal if there's injuries. You can't keep, if you're injured, if you're not going for the Olympics, there really is no reason to be running with a boot.
No.
I don't think there's a reason for that at any point in time. But that's like the main thing. You have to give yourself, many people do, and again, it's relative, giving yourself time to recover, giving yourself
Right.
time to heal from an injury or a surgery. I know people who had cancer and had surgery, and within a month after the last of their chemo, they're back at work at full time and doing their exercises and running marathons. And I have people that it's 2 years out and they still haven't gotten back to their lives.
Right.
It's like a loaded question, but the main thing is you really have to understand that there's a huge balance. It's not one thing. Just because you're really good at lifting weights, you could probably be 10 times better and not injure. I can't tell you how many weightlifters come in with torn muscles
Yeah.
because they didn't stretch properly. And most people don't understand how to stretch and what stretching is. And that's why people don't do it. Many people were not taught properly. We were all not taught properly. I'm a martial artist who grew up in a butterfly position with someone standing on my knees. It's the worst thing in the world that you could have done, but that was standard, and they still actually do it today. It's crazy stuff. I've seen football coaches for high school, for the kicker, they'll put the kicker's foot in a shoe half a size too small because it makes it a harder surface and they get a better further distance, but they're destroying that kid's foot
Yeah.
as he's growing up
Yeah.
in the time of when he's going through growth stages. So again, it's really understanding and knowing exactly and understanding the sacrifices and what it is you're doing.
It's so funny. This is like the perfect transition because again, when I came to you, as patients of mine know, I like to experience before I recommend my patients to do something. And I came to you just essentially to see about scar work, but then we started talking about stretching, and I found out that your background was extensively in being trained in active, isolated stretching, which is something that is that correct? That's something.
Yes, that was my background training. I actually, my version of it now that I work with is integrated therapeutic stretching, but
Okay.
yes, essentially the same thing.
Right. Essentially, I mean, because I had read about this and I kind of found it very interesting because, again, everybody gets different stories. You see people stretching wrong all the time. And then you hear about dynamic stretching. You hear about static stretching, and the active isolated stretching, or what you call the integrative
Therapeutic stretching.
therapeutic
ITS.
stretching, is essentially about not pushing to pain, to stretch to what you can, hold it for like 2 seconds, not longer, because something called the myotatic reflex pops in. And if you stretch beyond that or push beyond that, you can actually injure or tear the muscle. So I was like really excited when I found out that you knew a lot about this. And, I've worked with you on this. It's really helped my overall performance. As I said, I love tennis, and typically would get injured all the time. Maybe you could explain a little bit about your stretching program.
Well, basically, the integrated therapeutic stretching is works with the body, not against it.
Hmm.
Most of the way that we were taught to stretch was incorrect in that we're loading the muscle, and i.e. we're using it or standing on it, or like, for example, to stretch your calf, people will go to a step and drop their weight off their heel off the step, and then drop their weight onto the leg to stretch the calf. But the thing that's holding you up is actually the calf that you're trying to stretch, right? Your gastroc muscles. So your brain is telling the gastrocs to contract while you're trying to force it into a stretch.
Fascinating,
So you're
right?
fighting, most of the way that people learn how to stretch, they go to stretch their hamstrings, they're not in the proper position. They're either standing or using or leaning forward like bending at the ribs instead of at the hips, and pulling on their toes, which is basically they're causing a lot of issues. They're not in the right alignment in order to stretch. So what you want to do is, I call ITS is basically positional stretching. If I was going to stretch your hamstrings, you're laying on your back and activating your quads to lift your legs so that we can then stretch the hamstrings. The other thing about it is that most people stretch in mass. If you're going to stretch your quads, there's the quads means four. Technically, there's five now. They found the little fifth one, but anyway, four quads. They'll do one stretch. Well, that's four quads with 8 attachments. So I have 8 different angle stretches to hit all of the fibers in each muscle individually, and all of the tissue and fascia surrounding it. Because it's not just about the muscle when you're stretching. It could be your issues, your injuries, your adhesions, your scar tissue could be in the tissue itself, not necessarily down into the muscle. Like, for example, your Achilles tendon. A lot of Achilles tendon issues comes, again, most people like from gastrocs and your calves being too tight and pulling on the Achilles tendon that it forms. But it could also be the tissue, the sleeve that's around the tendon is adhered to the tendon due to, say, soccer, they got kicked, or from abuse. So it's not really the muscle pull. The tendon can't slip through the coating. The coating's
Right.
holding onto it.
Yeah.
So there's the stretching itself actually looks at the entire body. We stretch the way the body was designed to move. And as you said, 2 seconds, the myotactic reflex, or the stretch reflex, is designed to go off if you stretch too long, too hard, too fast. And believe it or not, that's so that your body can protect itself. It'll automatically tell after 2 to 5 seconds, it'll tell your body to contract that muscle that you're stretching to protect it and the bones and tissues around it. So if you hold a stretch past 5 seconds, you're basically essentially fighting, which is why people are sore after they stretch, or the stretch only lasts for a little while because they force the body into giving up, as opposed to working with it and re-educating the body as to this is how you do have more range of motion than you think. So all of those different levels come into the stretching. It sounds complicated, but it's really actually very easy. It's putting you in the right angle, moving the right way, lightly assisting and holding a stretch for 2 seconds. But
Uh,
I want to put into that just one quick thing as just a
sure.
little. The big rage right now is there's a lot of stretching franchises popping up all over the
Oh,
place.
right,
Okay,
right, right.
okay, I have years of training. I'm a medical massage therapist. Just because you're walking into a franchise doesn't mean that the person that you're giving up your body to, and that goes for your personal trainers and everyone else, actually understand how the body works. They know routines that they were taught without understanding. They know you can pick up a bat and swing it, but that doesn't mean that you can go to the major leagues and hit a ball.
Right.
Okay, so they don't have the basic understanding or the knowledge, especially, please, if you are injured or have a disease or a disorder, that is not the place for you. Please
Right.
go to a licensed medical professional who actually understands your body and the
Right.
issues that you've been through.
Right. Great point.
Mhm.
Is there any place like online though, if someone wanted to see any kind of videos, how to do some of the exercises that you're talking about? Have you done any? Do you basically?
There's a few on my YouTube channel. There's a lot, there's of me teaching classes, and there's a couple of videos of me doing some self-stretching.
Really? Okay.
And again, yeah, I'm very particular when I teach and I give the cueing, but if you're going to learn how to stretch, I really recommend that you find someone who knows how to do the stretching, learn from them, and then use the videos as a reference point. Because
Mm,
again, you might think you're doing what you're looking at,
right.
but more than likely you're not.
Yeah, no, I
Many
know. I know
times
from
I'm,
personal
yeah.
experience, how it's so important. I mean, little things that even you've taught me
Mhm.
that you could see when you're activating the right muscles or you're, relaxing
Mhm.
the right muscles. It definitely, it's an art. It's extremely important. And,
It's also about being nice, listening to yourself and being nice to yourself. Like we use a strap for the self stretching, as you know,
mhm.
and the minute I give someone a strap, they're like, ugh, and they like just start like
Yeah,
cranking on
right, right.
themselves.
Well,
And
everybody's been taught
that,
no pain, no gain.
yeah, and
More is
that's totally
better.
wrong.
Yeah, I
You
know.
want to know the secret? The secret is the somatic body, the part of you that tells all the muscles what to do. And here, this one does this one, this one does that one. Its main job is to keep you functioning. Well,
Right.
it's a 3-year old. And if you treat it as a 3-year old, you don't force it, you guide it, you work with it like you would with a 3-year old. If you don't do to your body what you wouldn't do to a 3-year old, there you go.
I
It'll
like
work.
that. That's good
You'll get so
advice.
much more out of your body, such a bigger response if you actually treat your own body as if you were working with a 3-year old. Doesn't mean don't do strength, don't do this, but it means don't force. Don't do it without understanding.
Right. Yeah.
Mhm.
Is there anything else that we haven't covered, before I kind of do a handoff where people can find you and stuff too? Anything else you want to maybe mention?
Just that understand that scar tissue is a lot more than you think it is. With the rise in C-sections throughout the world, and I'm saying the world, it's not just America. Every C-sections everywhere. Our rising cancers, United States. I'm from Long Island. We're the number one ranked for breast cancer. A lot of mastectomies. A lot of people doing proactive mastectomies because of that. All kinds of surgeries, all kinds of injuries. Amputees are returning veterans with their injuries and they're from their wounds, are not getting the therapy that they need. Scar tissue is a very, very big therapy. And I'm not saying it's the only therapy. I'm saying it's the first therapy. All your other therapies will be enhanced and better performance if you take care and clear your scars first. Um, all those pains, all those things where people told you it was in your head, that it's not really happening or it's just the way it's going to be, get over it. That is not true. I'm telling you that there is an answer. Whether you're a burn survivor, surgery survivor, accident, you're an amputee, you're a veteran coming back, you've been wounded in action. Scar tissue makes a huge difference physiologically, emotionally, and mentally throughout the body. And there is so much that you can do. And by addressing that first, you're going to make all of your other therapy more successful.
Well, I'm a believer. As I said, I've come to you and I've seen the kind of work that you do, and I'm really impressed. Where can listeners go to find out more about your work, about your practice, if they want to see you?
Um, for a person who's looking to learn about scar tissue for themselves, they can go over to marjoriebrook.com. That's Brook, Brook, no E's, no S's, just marjoriebrook.com. And for other therapists who are interested in learning the work, it's marjoriebrookseminars.com. You can get to either site from either one. I'm also on YouTube. There's a Facebook page, Brook Seminars, and Marjorie Brook LMT. There's 2 Facebook pages, and all the other social media. I know it's out there. We have it going on. Or at the very least, if you want, and you just want to have someone find out if it's for you, feel free to give me a call. My numbers are listed on the sites and everything else, and I'm more than happy to answer any questions for you.
Terrific. Marjorie, thanks for taking the time out of your super busy schedule to come on. I hope my listeners appreciate what you had to offer today. I know I do. And looking forward to seeing you again.
Yes, thank you very much, Dean.
All right, great. Enjoy your weekend.